I am going to record this. Thank you for agreeing to that. And if you could just kind of start out by introducing yourself and then give us an idea of your educational background and your career background.
Okay. Yeah. So I'm Brian Simmons. I'm a medical laboratory scientist is my trade of work in the healthcare setting. So for me to get to the point I have been, at least education-wise, I kind of went a non-traditional route. I first went to college for 4 years at UW-Platteville and graduated with a biology degree and had no idea what to do with my life, even after 4 years of paying for college. Kind of had an idea I wanted to stick in healthcare. Looked at a different couple, maybe possible grad school ideas, things like that. And one thing that looked interesting to me was the laboratory science field. So I decided to go up to UW, or not UW La Crosse, but Western Tech in La Crosse, and went into an MLT program there and thought I'd give it a shot for at least a semester and liked it from day one. After I finished with an associate's degree in laboratory science, worked at Prairie du Chien Memorial Hospital for basically since about I think 2005 on. When I first started there, it was within the as a phlebotomist first of all, while I was still going to school as an MLT, and then after I got my MLT degree and passed the exam, I worked there as an MLT for about 3 years. Because of my prior education, I was able to get the next certificate up, which is a medical laboratory science certificate, and that's what I'm currently at now. While at Prairie du Chien, that's where I've been for most of my healthcare career, at least for the working part of it. I've worked as a generalist, specializing in microbiology, and then about 3 years ago, I took a position as a part-time instructor at Southwest Technical College, which is here, of course, and been working as an instructor in the laboratory science program, which is very, have liked the job, but I'm now making another career switch that I'm going to be a infection control officer at Prairie du Chien Memorial Hospital. So it's a little bit venturing off from a lot of the clinical work, but still using a lot of the skills that I've had throughout my education that I've had. That's kind of my background at this point in time.
Thank you.
My name is Corey Schmidt. I'm originally from Richland Center, Wisconsin. I was raised in a dairy farm up there. I graduated from high school in Richland Center. I did my first 2 years of college at the 2-year college that they have there, UW Richland. That's where I met my wife. We moved to Platteville. We bought a house. We got a baby, and I worked and put her through school. She graduated from there, business finance, and then we switched. And she worked full time. I went back to school. I majored in biology. It was about my junior year when I realized that a biology degree really isn't good for a whole lot, other than to be used as a stepping stone. And I didn't know what I really wanted to do. I knew that I liked healthcare a lot, so I kind of contacted the department managers at Southwest Health Center in Platteville. I kind of toured all of their different respective areas until I finally came across Gary Andrews. He's the lab director there in Platteville. And I did a day or two job shadow there. Decided I really liked it. I did a phlebotomy internship there. I decided this is probably what I'd like to do. So I had, as I said, one child. We had another on the way. We had a mortgage, and I knew that I had to, when I was done with school, I'll start working right away. I needed to make some money. So I enrolled in an accelerated MLT program at MATC in Madison. I got done. I probably wouldn't recommend that for anybody unless you really work really hard, because it's pretty labor intensive. I graduated from UW-Platteville in May of 2012 and graduated from MATC in June of 2012. I was hired right away as a part-time lab tech at Grand Regional in Lancaster. I was only certified as an MLT, but because I had my 4-year degree, I was given the MT title and pay grade. I worked for a while. I was working full-time while I was being trained, and one of the techs there decided to reduce her hours. So that opened up a full-time position for me. I worked full-time, and then our lab director announced that she was retiring. And she approached me and she said, well, you deal with stress fairly well. I think you'd be a good fit for the job. And she encouraged me to apply, and I did. And I got the job, and I'm currently training to be the new lab manager at Clinton Regional Lancaster.
Thank you.
So I'm Bob Foster. I'm a registered nurse. I've been a nurse for 15 years. No. What's a year? Yeah, 15 years. I started off in the medical field as an EMT in 1988. I'm originally from Los Angeles and moved to Wisconsin here about 8 years ago. So I worked as an EMT in Los Angeles, and then I worked in several different ERs as a tech. And back then I was thinking about doing physician's assistant school. So when I got a bachelor's degree in history, also very helpful, not as helpful as a biology degree. At that point, for physician's assistant programs, you just needed a bachelor's degree in anything, and then you could, as long as you had some clinical experience, then you could apply to PA school. But by the time, kind of same with Pam, by the time I got all my prereqs done for PA school, I just couldn't afford it because I had a wife and 2 kids, and just too expensive. So I went to nursing school, and I went to got an associate's degree first. Graduated in '98. So, since then I've worked in pediatric ICUs and ERs and transport medicine, pretty much exclusively. I worked in several pediatric intensive care units in Los Angeles, including Children's in LA and UCLA, and then I worked in ERs, including big hospitals like UCLA and smaller places. I was a flight nurse in California for a couple of years. I did rotary and fixed wing programs. Rotor was almost all 911, seeing calls in some inter-facility, and then the fixed wing program, we did some inter-facility, but we had a contract with Shriners in Sacramento, so we'd fly down to Mexico, pick up really bad burn kids, and fly them to Sacramento. Then moved here, started off in the ER at UW, and also worked in the Peds ICU there, and then I started doing what I do now full-time. I work for Cheetah, which is basically the Children's Hospital Emergency Transport Ambulance, so it's basically PEACH transport. So I basically work with MedFlight people, but I all I do is kids. And I've been doing that for 2 years full-time, but I still pick up in the ER and the Peds ICU. I'm also a volunteer EMT. And I've been doing that because I always try to keep my skill level up on everything as much as I can. That's really important. So and then 2 years ago, I got my BSN from UW. So I have a bachelor's in history, a bachelor of arts in history, a bachelor of science in nursing, and then an associate's degree in nursing.
Thank you. Could each of you answer what prompted you to get into this field? Like, did you start out wanting to do this, or you kind of said a little bit what led you in this path, but
I didn't know exactly what I wanted. I wanted to do something kind of related to healthcare. I looked at a couple of things, possibly public health with a biology degree when I first graduated. Some of them didn't maybe pan out for grad school purposes, and other things where you kind of look at the cost of a grad school is that's something I wanted to add on to already my 4-year degree cost of what I had. So when I looked at the MLT field, it was it's something that seemed interesting at the time. I didn't know how much I'd like it until after I first started doing the program, and after really getting into doing the first couple clinicals that I got to be in on, it was a way that I could see that I had an effect on patient care at that point in time. Even though it wasn't maybe hands-on as a nurse or anything, it was still, you were making a difference even behind the scenes of what's going on with that patient. So I felt you were helping somebody for what you're doing with your line of work.
thank you.
I know with me, when I was in college, I tended to gravitate towards lab-oriented classes. I like doing that kind of work. I like the idea of healthcare, being able to help people and very similar. I wasn't into nursing, I didn't think, because it was too hands-on for me. The only time we really have patient contact in the lab is to draw blood. I had a good experience at Platteville, and I was able to, it's a small lab, so everybody there is a generalist. And in a lot of big labs, you have somebody that works in hematology all day and somebody who works in blood banking all day. But in the small rural areas, you have people who are generalists that work in all parts of the lab basically all day long. And I like that, a lot of variety.
Thanks.
For me, I kind of touched on it a little bit, but kind of by the time I was about 19 or 20, I knew I wanted to, help people in some way. I was thinking about like teacher, cop, or nurse, or medical field. And like I said, originally I was looking at PA because as an EMT and as an ER tech, there was a while there where the last thing I wanted to do was wipe butts. So I'm like, yeah, I really don't want to be a nurse. But after working in an ER there, my first, when I was an ER tech, it was just a 9-bed ER, about the size of Lancaster actually. I worked as a tech there, and there was one nurse who was really good, and she, so I respected not only her, but I respected how she viewed nursing. So then I thought, okay, I can actually do nursing. I think it's, you're not just wiping butts, but you actually you make not only a clinical difference, but it's a very respectful job. So then when I couldn't get into PA school, I was actually pretty happy with becoming a nurse. And since I've become a nurse, I'm actually very happy with the decision, only because when you are a PA, you're actually pretty limited. Once you finish PA school, you do not an internship, but you basically get a job in either plastic surgery or ortho or something like that. And then you're kind of stuck in that career where nursing. You can be a school nurse or flight nurse or work in a clinic or work in a prison, or you can do just about anything. So that's the nice thing about nursing. And then the other good thing about it too is I know it's one of the few jobs where you get an associate's degree and you basically start off at about 50, 60 a year. So I'm happy with that decision.
Thank you. What do you see as the advantages to being a male in your field?
Advantages. Say some of the disadvantages when you have really patients, you're the ones that got to get out there and help out. For advantages, looking for a job, I would say, at least in a lot of, especially maybe the MLT field, because it seem to be a lot more female oriented, and this might make true even in the nursing world. Males might have a better chance of actually getting hired over females just because there's not a lot of males around, typically in those fields. Where I work, we actually have 3 males actually in the lab, so it's kind of actually a high percentage of males, one of the higher percentages in the hospital when you compare of all the things that go on. So I'm thinking being a male, you might have a better chance of actually getting hired at institutions just because you're limited. It's kind of like how some of the younger teaching fields is. If you're a elementary school teacher and you're a male, you seem to have a better chance of getting a job as a school teacher because they want that type of influence around. So it might be maybe there's a better influence to have some type of a male influence around, just because you get certain patients that might not act appropriately with women, or might be shy of women. So you actually have somebody that can actually go and communicate with them and things like that. That's what things that have noticed in the past at times too.
My experience has been pretty similar. Just to comment, you do have patients that are unruly sometimes. You get male patients sometimes that are coarse and vulgar, and you need to have, it's helpful to have a man go in because they're not going to give you a hard time, and you can get your work done and get out of there. I've noticed that there is a lot of bias towards men. I notice me and one of my colleagues can enter a room. She's female, obviously, and they'll say, "Oh, the nurse and the doctor are here." And I go, well, neither one of us are nurses and neither one of us are doctors, so people just don't understand I'd say a lot, what the strength might be is that I'm the only male where I work, and I think people tend to look my direction if we need an opinion, because it tends to be different than everyone else's. I don't know if that's because I'm male or because I'm weird or something. People tend to look to you for your thoughts.
I guess I'd echo a lot of the same things they said. I think certainly the positives are, I mean, especially in ER nursing, not so much pediatric ICU, because usually you don't have a lot of unruly babies is a whole different thing. But for ER nursing, which is, I know most males go into either ER or OR, that seems to be where a lot of males gravitate towards. And I think it's because of that. But yeah, when you have a male nurse, sometimes it's you're treated differently, and you're treated by the medical staff differently, and it's kind of there is a sexism involved, because there's a lot of times the doctors will have more respect for you just because you're a male as opposed to a female, and it's pretty unfair, but that's just how it is. Male physicians, female physicians, it's less, but it's still not even. And then as far as taking care of patients, same thing. If there's a female who walks in, they may give, a patient may give them more crap than they would, a male, because males, generally are not going to take as much as a female. And obviously these are huge generalizations, because there are some really tough female nurses, and and then there's some really gentle, male nurses. So it's just they're huge generalizations, but generalizations still unfortunately mean a lot. Some of the other positives are, I think there is, like I said, I think there is a more respect for males in the nursing field, and it's not necessarily deserved. I think it's just because of societal pressures on it. And also just because you're a rarity. If you're working on a med floor and you're the one guy, oh, you know what, we need to move this patient, where's the one guy? Okay, hey, can you help? So you're needed more in a sense, because if there's 2 guys and 15 nurses and you have to move somebody or do something that's heavy, or you have a patient that's a little unruly, the guy nurse is the one that they're going to call in. And it's kind of a blessing and a curse, because, you're needed, but then it's harder to do your regular job, because you're always being called in different, we need help moving this patient, we need help holding this guy down because he's fighting, so it's harder to do your normal job.
Thank you. Some of you already addressed this with that question, but what are the challenges of being a male in your field?
Challenges. I always find sometimes it's probably more than just being a male, because certain people have families and things like that, but females tend to are the ones that are going to have the kids. So it can be a challenge sometimes to schedule yourself around mothers and things like that, which is not a bad thing. But that can be sometimes a challenge where you might be asked upon to cover more of the undesirable shifts once in a while, because they have a birth that's just happened and you have to cover, or for a few months on certain things, or a sick child at home, things like that, which again is not a bad thing, but it sometimes can be a challenge. Also, I would say there's always challenges when you work with the opposite sex. There's sometimes the chemistries are never the same, so sometimes females are having a bad day and males can have a bad day, so sometimes you have to, like maybe in a smaller setting like we are in Prairie du Chien, it's almost like you have a little family, and they're almost like your sisters that you're with, and you have an idea to know when you're on somebody's nerves that you know when to back down and things like that. So I guess it can be a challenge sometimes working with the opposite sex, just because we're not, men and women aren't different. So it's just like probably being in a family household growing up, you're going to have times that you just don't get along and times that you do get along.
Ditto. Very similar, yeah. I mean, I work with all women, and it seems like every day I'm probably on somebody's nerves. And that's okay, I suppose. And just like I said before, everybody tends to look to you for your opinion, which could be a strength, that's also a weakness. It means I always have to have an opinion.
But you might always be wrong.
Sure. Sure. Yeah, exactly. You know, other than that, I don't think, at least I have not encountered a whole lot of other weaknesses. I don't think I've been held back at all, being a male, and primarily female-dominated field. That's all I can come up with.
Okay, thank you.
Yeah, I guess I would say the same thing. There's probably two big things. I have found since I've worked in large urban areas that there seems to be more of an acceptance of male nurses in the bigger cities, only because there's more. Like I went to school at LA County USC, which had 75 nurses graduate, and I want to say 35 were men. So in the urban areas, because there's a chance to make better money, and sometimes the jobs are a little harder, I think nursing is a better way to make good money quick as a nurse. So I think there's more of an acceptance in the urban areas as opposed to outlying areas like this. And but then also I think there's an age component too, because like most young people, I've never had a problem with. But sometimes, kind of like he said, I can't, countless times where I walk in with another nurse or a female doctor, and then said, "Oh, the doctor's finally here," and then they start talking to me, and that's just insulting. But and then the other part of the ageism, or not ageism, but the other part of the kind of it's not racism, but the other thing that's kind of bad is a lot of times some older people will say, "Oh, so you're a nurse, so when are you going to become a doctor?" Like it's just a stepping stone. Like, why would a man ever want to be a nurse? Because, it's only for females. And but that's generally the older generation. But I think that's gotten certainly a lot better I've been in the medical field for 28 years, so it's certainly gotten a lot better over time. I think it's much more accepted than it was 10 years ago. But those are, I would say, the kind of the big negatives.
I think I've noticed more than a gender difference, an age difference, where if you're talking to a patient and, being younger, especially younger than all the other techs working there, they think that there's probably no way that you know what you're talking about, or they say, "So when do you graduate?" Or they say, "So you're going to be a doctor soon?" I say, "No, I'm exactly where I want to be. This is what I'm doing." And they say, "So you're a nurse?" And I say, "No, I'm not a nurse either. I'm a lab tech." And they just don't understand what that means.
And I'm always amazed at the things, as just a lab tech or technologist, you find out that because you get that impression, you walk in and think you're a doctor, the things they tell you, which they wouldn't tell the nurse, but they told you because you're a male and they think you're a doctor, that's going to affect their patient care. It's just like, you need to be telling this to the nurse that you're talking to, and it is one of those things that happens all the time.
And actually, and this is kind of a weird little thing, but I know a lot of the magnet hospitals and a lot of the larger centers are coming up with badges that actually say, like, hangs from the bottom and it says RN, tech, lab, something like that. So when you walk in, that's the first thing that you see. So they just don't see a badge where you have to look up close, So right from the get-go, you see whether you're a nurse or a physician. And I don't know if you guys are doing that here in the smaller places, but they're really pushing for passing information. And so, like, on the board, it'll say, who your nurse is, who your doctor is, and all that kind of stuff. Mm-hmm. And I think that's helped a lot, too, because then there is no guessing. You don't have 15 people, because I think probably all of you experienced it, where you're either in the emergency room and just all these people come in and out, and they don't tell you who they are, they don't tell you what their job title is, and it's frustrating. So I think that the passing of information that says, you know, hi, I'm Bob, I'm your nurse, that's my name on the board, I think that actually has helped a lot too.
I know our nursing staff has started to do that. They have. It does say, right in big letters, nurse or
Right.
nursing. Lab, we don't have this for some reason. I don't know why.
But you should.
Eventually they might, who knows?
Yeah, because I think it's important for everybody to know who everybody is.
Yep.
I mean, I'm talking about not staff, but
Yeah.
patients.
Thank you. I'd like to open it up to anybody else who has any questions.
I have a question. Could be for Brian Corey or Bob. Do you see more men coming into the medical field? Obviously, I know the question is probably yes, otherwise we wouldn't be in here listening to you. If there are more men going into the medical field, why do you think that is?
Well, I can say it's, the money's better. And even when I started, so I started looking into nursing in like 95 or something like that, and this was in Los Angeles, but the money was starting to get better. Before that, it was right up there with teachers, you know, you work really hard and you still, you know, you work your butt off and you still don't get paid very much work. I think in not just nursing, but like respiratory therapists, it's a career in basically any of the healthcare field now. It's a career where once you get your degree, you start getting paid well, and that's actually, especially now with kind of the flood of people who have, you know, bachelor's degrees and still can't find jobs, that's concerning. So you want to, you know, just besides that, I want to help people and all that kind of stuff. I think it's one of the few careers where once you graduate, you pretty much have a steady job until you don't want to do it anymore. So I think that's one of the big positives of it. So I think that's drawing more men in, you know, because you look at kind of the generic men jobs, construction, and, you know, manufacturing and stuff like that. And, you know, the United States is becoming a service industry. And so, you know, all those other jobs are moving away, but you know what? You're always going to need a nurse. You're always going to need somebody to run the lab. You're always going to need a physician. That's not going to change anytime soon. So I think there's that. And then, like I said, because not only is there a nice steady income in it, but the pay is good. It's good pay. I mean, the last couple of years I've made over 6 figures. And that's pretty good for a bachelor's degree. So, and like I said, I started with an associate's degree. So, you know, you get an associate's degree and you can make pretty good money, as opposed to getting a bachelor's degree in history or biology or something like that, where, because I honestly, I love history. I love teaching history. I would love to be a history teacher. And when I got my bachelor's degree, I actually took a course of Imperial China. It was an upper division course, and I loved it. And the instructor was like, "Why don't you do this full time?" And I'm like, "Because I make more than you." You know, I mean, he's a professor, and he probably makes, you know, 90, 100,000 a year. So, you know, and I'm like, I don't want to have to work my butt off to get a PhD to make the same amount you do. So I think those are probably the 2 big reasons: financial independence, in a sense, and just because it's more respected too. I think, you know, 10, 20, 30 years ago, you know, you were a nurse. You know, you know, there was nurses who had the white caps, but other than that, then you look like an orderly. Now it's, I mean, everybody wears scrubs and you can't even tell anymore. So I think because of all of the combination of all those things.
I think you get it right. I think the stigma is kind of went away of nurses just for females and females only, or healthcare jobs. It is starting to be seen more. That stigma has gone away. But I think the ever-changing economy in the last 10 years has, with all the different jobs leaving and going across seas for all these manufacturing, I think men are starting to see that because of a service industry, healthcare itself is a place to find a job. Like you said, you can get a degree and get a job right away. As doesn't matter male or female right now. If you get a nursing degree or a MLT degree, you are pretty much guaranteed to find a job within a certain radius of where you're living. And it's going to still increase, at least should increase, because the population that we're going to be taking care of is going to be getting older and larger. So there will be a bigger need and so on. So.
Yeah, I mean, I know there's some stuff gets published all the time, the huge need for nurses. And it's just as the population ages, not only is it harder for you to take care of those kids, but, or sorry, that's my peds. Harder for, there's going to be more patients to take care of, only because of the aging of the population. But then on top of that, also a lot of the nurses are retiring. So so there's less nurses to take care of more patients. So, it's just kind of a no-brainer.
Is that also true in the lab?
I think the labs, I think you've shown that way in Lancaster for what's going on over there and stuff is we have, in my understanding, and from I've always known it's been an older group of people to work with, and they're starting to retire. And Prairie du Chien, where I work at, we're actually kind of a younger, we have nobody over the age of 50 in our lab. So we've kind of gone through that change already of some of the older people have either retired or uneventfully had passed away from health illnesses and stuff. So now we tend to be a younger lab. But with us being young, currently I know we have a tech leaving because there's a better position for her in her life to go somewhere else. So we're going to see a lot of younger people that we do get go to other places because those opportunities are there because of not enough people or older people that are retiring and so on.
And just to give you, not just nursing, just to give you a quick example. So on my transport job, we have something, it's like an iStat, but it's called an EPOC. And basically, it's a little machine where I get like 0.2 mLs of blood, I put it in there, and I can get a full CBC, chemistry, H&H. Not a lactate, but no.
You can get a lactate.
Yeah, you can get a lactate. Well, it depends on the cards.
Yeah.
Because they have different cards. But and so one part of you thinks, well, because of technology, maybe that's going to take away the labs. But the thing about lab is that, you know what, somebody has to make sure that that works. Somebody has to make sure that you're following all the, rules and regulations, and so even technology still may improve things. It's still that's going to be there for a long time.
Your test menu is always expanding as well.
Right.
There's always a new variety of tests that you can add to require more sophisticated equipment.
And I was just at a conference last week for microbiology, and that's kind of a discussion we had, was kind of the downsizing of microbiology labs, because they can say you get a new instrument, that you can get a new instrument and you'd be able to, one of the things they may say to get that instrument is that I can get rid of staff or not have to replace the staff that's retiring. But the thing to find out is once you get that new instrumentation, there's a lot to go along with that, and if it's a molecular analyzer, it might be a whole day process for one tech to run 20 or 30 samples for a day, because they have to do all the prep work for it, they have to wait for the molecular test to get done, report it all out, take care of the instrument, and that might be that one position you talked about that was going to downsize. You have to take one person and fill that position to run that analyzer. So even with technology changing, there still have to be people that are going to be trained to run those instruments. Even though they're doing all the work for us, you got to know the ins and outs of them, or how to maintenance those instruments so they are running properly to get the right results out and so on.
I think another thing too is with the change in healthcare in the next couple of years that's coming, I think, I'm not sure too much about lab, but I know as far as nursing, nurses are cheaper than doctors. And the rest of the world has seen that, and because I do a lot of international trips, I go to Ethiopia often and do teaching there and stuff. And nurses are cheaper than physicians, and so there's going to be, and the doctors are getting pretty terrified of this actually, and they're actually changing medical school to be more like nursing school, which is actually kind of funny. But they just are starting to see that there's a much bigger need for what you need at the bedside to help and to take care of patients, as opposed to like physician and hospital-based nursing care or care. So as far as that's concerned, I think that's something that a lot of people, besides maybe nursing programs, aren't looking at too much in the future. But that's a huge growth curve right there for nursing. Thank you.
I have a question. I know that the occupational outlook for the medical field as a whole is pretty positive, and I think, Brian, you're the one who had said one of the advantages of being a man in your industry is that you're more likely to get hired for the diversity. Do you have any other information, because I work with our students on placement, any other information or advice that you could share for me to work with the students on placement and helping them search for jobs and finding jobs?
I think what you'll see at I know a lot of the labs around here, you'll have a population of lab techs, and 80% of them are age 60 and over, and then 20% of them are age 25 and under. And there aren't a whole lot of people in between. So we have, I know where I work, we have several retirements approaching, and there's going to be a lot of opportunity for job growth. And I think the best thing that they could do is to call informally, talk with the lab manager and say, hey, can you come tour your lab? And it's an excellent way to get your name out there. They want your contact information. I know I toured several labs in the area. I talked to Darlington and to Platteville and to Boscoville and Dodgeville, went all over, and I found my job in Lancaster, and I know after the fact I got 3 or 4 phone calls from lab managers saying, hey, we have an opening, do you want to apply? Just because it's difficult for them to get a lot of applicants in a rural area like this.
And I have seen in this area kind of, I don't want to call it a revolving door per se, but because of those opportunities, you see some of us that are kind of in our 30s and maybe early 40s, and that opportunity has been kind of there you might be able to find something better that's within your area because of that opportunity to go to a different facility or so on. My example was when I started teaching, it was an opportunity for me. It was something that I was interested in and would probably maybe be near off in the future, but it was an opportunity for me to broaden my skills of, yes, I have the lab skills, but something I've always been interested in has been educating. So it was an opportunity for me in this area to be able to do that. And now, again, this opportunity has changed a little bit more to go back and look on the infection control field. I was saying epidemiology, so just teaching that earlier a second ago. But seeing that as a different way of a field to kind of take what I've been learning and look at a different way of helping what I can do. For a question of how to, maybe what to recommend, if you have people that are very young, that are still in high school, that are still kind of unsure what they're looking at, but they know they want to do healthcare, I would recommend getting into high schools even before they're juniors and seniors and trying to get them more interested in a lot of the sciences, especially the health sciences. There's a lot of people or students that I've seen that have come through that would have been maybe even more interested earlier on in doing healthcare nursing. For some of the students I have in microlady for nursing, I've mentioned that. Some of the lab students I've talked to, if they've actually had more contact in their high school settings with the health sciences. I think it's probably better today than it was when I ever went through high school 20 years ago, but getting that influence, be able to go to healthcare settings and see what goes on, job shadow different nurses or respiratory therapists or anything, I think would be a very beneficial way of introducing them to the field and then being able to have them get an idea to learn from somebody, hear from somebody of what they did to get to where they're at. I think would be beneficial.
Yeah, I would say, well, there is no bad education. That's kind of one thing I've always learned. Even if you take a job or you take a volunteer position, you hate it, well, but now you know you hate that. Now you know that that's not something that you want to do. So there is no, as far as I'm concerned, there is no bad job. But I would say as far as placement is concerned and trying to get jobs, probably the 2 best things you can do, I think, is volunteer or somehow get in. Whether it's volunteer, volunteering is a great way to do it, only because that way, like if you volunteer in a certain unit or, in the hospital or something like that, you can generally see, as a volunteer, you get kind of become a gopher and you go around, so you get to see a lot. So you get to say, you know what, okay, the emergency room, I hate it, but I like the lab, whatever. So I think that's a good way to do it. And then the other thing is like as you're going through, or like as you're about to finish, put a face or at least a voice to the name. So like, let's say you're getting close to finishing, and so you want to, you're trying to try to get a job at Dodgeville or 3 or 4 different places. Whatever department you want to work in, call them. Don't go through human resources. Human resources is the DMV of the hospital. But call the, whatever department you want to work in. So if you want to work in med-surg, call the med-surg manager and say, hi, I just put in an application, I really want to work there. You really have to be proactive, because when they see 15, 20, 50 applications in front of them, if there's not a name to the face or a voice or anything, and especially when you're first new, everybody looks the same, So if you have a little volunteer experience, to say, I did some volunteer work in blank, and so I realized that I really like, where I want to work, and I'm really interested in working your unit, and why. That manager is going to want to call you. It's just human nature. It's just psychology. Whereas if you're just a piece of paper, the same as the next 20 next to you, it's a lot harder to get that job. I think I've been pretty good about getting jobs. I think every job I've applied for, I've gotten in probably the last 15, 20 years. So, including like the flight job that I had in California. I think there was 30 experienced flight nurses applied, and I still got it. So it's just a matter of just doing human nature stuff, putting getting in, showing that you do have interest by looking at your resume, but also putting go in and meet them too. If you're really, let's say you really want to work at this place, go in and find the manager. It doesn't have to be anything official, but just get that little extra means a lot to them, because that means, okay, so on, in 6 months when he's here, he's going to put a little more extra effort in doing that, as opposed to the person who just handed me a piece of paper to Human Resources, 2 months ago. So it's all about effort. That's what I would suggest.
I know we've hired a couple I know that one tech that's actually leaving now, but another different one. They were ones that had applied recently before, and actually, like you said, they had stopped in, and one of the things at the time, we maybe hired somebody that was more qualified for a bit, but then we kept them because they knew they visited and stopped. When we had need for another tech, we actually contacted those other people right away and ended up hiring them. So it was beneficial that they actually stopped and said that they were interested in doing that. And then also what you were saying, I know with my new position that I'm going into at the hospital in infection control is, when that came a word that the person was going to be retiring, I personally talked to that infection control nurse that was leaving and let her know I was interested. And she couldn't believe it. You were really interested? I did. Yes, that's something I have been interested in. Some of the things I've done at the hospital, that I've worked with the microbiology and certain committees I've been on with the state lab of hygiene, work with a lot of what she's doing. And she was, well, I wasn't sure if you'd want that. So just by talking to her was probably beneficial that I talked, because if I didn't and just put an application in, I maybe would have never got an interview for it, or it's not possible. So making that contact is a big thing. And I've seen it personally work for me, like you've said. I've seen it work for other people. If there's somewhere you're really interested in, at the very least, even if you don't get the job that first time, maybe down the line that might be something they remember. Oh, somebody had stopped and they weren't maybe as qualified as we wanted to. They got hired somewhere else. They have a couple years of experience. Maybe we'll give them a ring to say there's a job opening. Not trying to steal some people, but again, that leaves an influence on them.
I'll give you a recent example. So we just recently hired a PEDS transport nurse on our team, and it's a nurse that I wouldn't know from Adam. However, she works at one of the local EDs, and every time I came through, she's like, "Hey, Bob," she remembered my name. She's like, "Oh, I so want to do this job." I've been so focused on doing that, and so I remembered her name. And so when her application came across, and obviously I'm part of the people that chose, she wanted the job. She's been telling me that for 2 years. So that means something, as opposed to just, here's my application, thanks. That's such a different thing than looking somebody right in the eye and saying, I want this job. Please give me the chance. Just makes a huge difference.
Question, I guess, I got as far as the nursing field. I know they keep saying it's wide open and everything like that, and you talk to the nurses maybe from some of the bigger hospitals, things like that. A lot of cutbacks. I know the LPNs are kind of non-existent, CNAs are coming up, associate degree RNs. I said, more of a floor nurse, bachelor's degree. Basically, if you want to be a little bit more as far as the ER or anything like that, a little more direct. I guess my question, do you really see that that's happening, that like an associate degree RN would have a hard time finding a job on the floor in a bigger hospital? So many of them are saying now that, oh, you're going to go work in a nursing home and 2-3 years experience where they're going to take you in some of these bigger hospitals. I mean, kind of like yourself, I don't want to wipe butts.
Right.
And, you know, that's, I don't want to, that's not going to
Right.
be my livelihood at this age, so.
So that nursing schools have been kind of spewing that stuff for a long time. I know that even when I got in the field, they were like, you know, I mean, even before I became a nurse, when I was in the field, like in the mid-90s, they were talking about, you know what, associate degree nurses, we don't need them anymore. We don't need them. You know, everybody should have their bachelor's degree. However, the problem is there's not enough bachelor's degree programs. And the second thing is this is my personal opinion, but actually it's opinion of a lot of people. Associate degree nurses are actually better trained nurses, and I may get a little heat for that, but just to give you a quick example, and I know it's getting better in the bachelor programs, but the bachelor programs are so focused on theory. And just to give you a quick example, so I went through a hospital-based associate degree program. So by my third semester, I had 8 patients in an NA on the floor by myself. So that was my nursing school, and I went and worked nights at UCLA, and their bachelor's nurses would get excited in their last semester if they got to spike a bag. So because they were so focused on theory, they gave up a lot of the clinical bedside. You know what? Okay, you know, that gut feeling of, you know, that person looks sick. There's something going on there. And I just didn't have that. And so it's almost kind of like a really good internship. So I think that it's like I said, it's getting better. But anyway, I'm getting off subject. I think that's stuff that a lot of people have been saying for a long time, and it just, because there's such shortage, it's just not going to happen. I think this is a different area too, only because Madison is a smaller town with 3 big hospitals and 2 bachelor's degree programs, and at least 1 in town, not to mention all the other ones. So it's a saturated market. So they can choose to say, you know what, we only want BSNs here. Where in my mind, if you go out anywhere outside of that, they'll be like, yeah, sure, we'll take you, just because they need people. So I think Madison is a weird market only because it's very saturated, and I know a lot of people that have graduated from MATC and stuff like that. They can't get that first job in the ER, and I think it's really unfortunate, because I think they're, you know, you don't have the theory, but you know, to be an ER nurse, there's not a lot of theory. You're putting out fires. That's all you're doing. You know, you're basically moving from one patient to the other, putting an IV in, doing your quick assessment. You're moving on. You know, there's not a lot of theory involved with that. I mean, granted, I think to go on and get your BSN is important, because I'm glad I got mine, but I'm much happier that I got an associate degree first. So I guess, to make a long story short, which is way too late, but don't worry about it so much. The other thing is the more experience you can get with that associate degree RN, so whether you're a local, you know, a volunteer EMT, or you're volunteering, or you're an NA, the more experience you get with that, the better chance you are at getting a job. And a great example is, if we have a couple of ER techs that work at UW, they get their associate degree nurse. Well, usually we don't hire associate degree nurse, but you know what? They've been in that ER for 2 years, and we know they're great. They're going to get hired. So there's always ways around it. And one of the other ways is, like I said before, you know, if you want to work in a place, you make sure that boss knows, or your future boss knows, you want that job. And you know, sometimes there's management that just says, you know what, we're not going to do it. But they'll still remember you. Like, you know, in a year or two, when you get that you know, whatever med-surg job under your belt or whatever, they'll still remember you.
I was going to say, for me, being married to a nurse and knowing a lot of the nurses down where I work, just because of the extra thing of her being with them all the time and stuff, I think I've seen that I feel that there's a lot of associated nursing degrees that I would rather have be my nurse when I'm a patient than some of the bachelor degrees that we have in their institution. I don't mean that as a bad thing towards them, but I think, like you say, that going, and I have a sister that's a 4-year degree nurse, and I think she thinks totally different than my wife, who's an associate's degree nurse. It's the way they are basically trained. And you're more on the care of the patient, I think, as that 2-year degree than anything. And they're trying to make you more, they say, well-rounded with a 4-year degree, and I think they lose a little bit of that patient care aspect. So at least I think I've noticed it from what your opinion is.
It's not that they lose patient care aspect.
Mhm.
I think what it is so much of the bachelor's degree education is based on you know, research and doing things that when you're at the bedside, it doesn't matter. Where, you know, in a 2-year degree it's a technical nursing degree, and that's really kind of how you want to think about it. So you're a really good technical nurse. You may not have the theory behind it, but I think it's better to learn the technical stuff first and then learn theory later, as opposed to trying to throw all this theory on when you haven't started an IV. You know, I think it's kind of I think what has happened is they kind of put the cart before the horses. You know, so I think it's much better actually. And actually, when I went back for my BSN, one of the major professors at UW is a huge believer in that. She thinks every nurse should go to get an associate's degree, practice nursing, and then get their BSN, because and she says that they're almost always better nurses because you have that associate's degree, then you get the theory, and then so when you're looking at it, you're like, oh, well that makes sense. So when I do that happens. But when you're the bachelor's degree nurse and you don't have a lot of experience, it's just book learning, you know. So that's my opinion.
Speaking from my experience at our clinic downstairs, I know that they have a single RN working, and there are probably about 15 CNAs, and you know the reason for that is there's a demand. So I don't see that as going away anytime soon.
So yeah, just don't worry about Madison. Kind of ignore Madison. Madison is an outlier. I mean, it really is. It's a weird outlier. I mean, it's a weird town.
But the acceptance you're saying, as far as to go into something like that with an associate degree, and then, you know, with kind of the verbal and on your resume, you know, that my plan is to continue on with my BSN as I do this.
Yeah, and actually that would be, besides kind of all the other stuff I said, if you go and you say, yes, I have my associate's degree, I am a volunteer blank, I have lots of experience with blank. If you're in the process of getting your BSN, that adds a lot too.
We've seen a lot, like, I know you said the terminated status, and I know that's been pushed around in rural areas, but the rural areas just
They just can't afford it.
can't afford it, can't be up there to hire all these higher educated staff because it costs the money, and especially in the rural area, it's the this school having the program here for nursing, I think, is a blessing, because a lot of these hospitals in this district would be really struggling to find nurses to work in their settings. And I think that's where the MLT program is going in the future too, in this area. We're going to be struggling to find help shortly too, because we don't have the trained staff in the area.
Yeah, and that's why I think and most people who kind of know what they're talking about think it's always been a joke, where you know, well, soon you'll have to have a master's degree just to be a nurse. You know, they've been spewing that crap for years, and it's just, the problem is yeah, if you live in your ivory tower in, you know, in Madison or, you know, some big university, yeah, that's how it looks to you. But you come out here to Platteville or go to, you know, Middle Nebraska or North Dakota, you know what? They need nurses. So.
And I think one field that's kind of done that in reverse and kind of went that way has been kind of physical therapy. You got to go and get a doctorate's degree now in that field, and it's almost, I think they might have hurt themselves a little bit for at least people finding jobs. But then the field that's going to really grow would be PTAs, because they're going to do what a lot of physical therapists were doing for years, because they're going to be cheaper, but they're going to make some money doing it, I think, in the future.
Just to kind of go along with what you were saying, Bob, you just kind of caught my attention basically on the flight nurse and the ER nurse. Going into something like that, whether you're a bachelor's or an associate degree, do you need some other kind of directness to get into something like that?
Just to flying.
Or under your belt as far as, experience or schooling or something like that, to be that flight nurse or to be that,
No, actually, you don't. I mean, I was flying with an associate's degree. Basically, it's once you start getting the experience under your belt, that means nothing.
Okay.
And it doesn't mean anything to anybody, really. Because, like UW, basically, even when I applied, they're like, well, we don't really hire bachelor's degrees, or we don't hire associate degree nurses. But then I'm like, okay, well, I've been a flight nurse and I've worked at UCLA and their ER and their pizza, and they're like, oh, never mind, come on in. So as soon as you get that experience, they want you, and that's really all I care. That's all they care about. As far as flight nursing, there's basically, if you're interested, there's basically 4 things that every flight program is looking for. And med flight at UW is an outlier because they fly with physicians. They're one of 4 or 5 programs in the whole country that fly with physicians. And so it's not the flight program that's like the rest of the country. Most of the rest of the country is nurse medic, or if it's a PEACH transport program, it's nurse RT, or some of them flight nurse. But basically the 4 things that every transport thing wants is ER, ICU, some form of PEDS experience, whether it's PEDS floor, PEDS ICU, and unfortunately ER doesn't count. And most places it's actually kind of said ER doesn't count for critical care, so you really need to get some ICU experience somewhere. And then field, volunteer EMT, something like that. If you get those 4, kind of the rule is, if you have those 4 under your belt and you've been a nurse for 5 years, you get a certification, whether you're in the ER, so CEN or Certified Emergency Nurse, or CCRN or Critical Care RN, or CPAN, any one of those certifications. You get any one of those 4 jobs in that 5 years somewhere, and then in 5 years you're basically met. You're ready to go, and then you can start applying. The problem with transport nursing is there's not a lot of jobs, so it's really tough. It's a hard field to get into, because Wisconsin's got 5 million people. I think there's 6 programs in the whole state. So, being a male nurse, a lot of male nurses want to be flight nurses, and so, that's one nice thing too about being a male nurse, is it's a little easier to be a flight nurse because there's a lot of heavy lifting and stuff like that. So you get these little slight nurses, and who are like 5 feet tall and trying to lift a gurney on the back of the helicopter, do some rescue stuff. It's not easy. So that's basically, you get those things in, and then you're kind of golden. But it's a process, and like I said, there's no bad experience.
Right.
So.
Okay, thank you.
Any other questions? Okay. Well, I know we're at our time, so thank you very much, and feel free to, if you have time to mingle a little bit, if anybody has any personal questions you want to ask. But we thank you for your time. It was very informative. So thank you.
Thanks, guys.